Are you an aesthetic injector? Then I'm sure you must have come across apprehensive, nervous patients whose behavior distracts you while you inject. The ones who already start feeling the pain the moment you hold the syringe in your hand. If yes, then you are not alone. We've all had our share of such nervous patients at some point or the other. But if you are a beginner, then it becomes difficult for you to juggle with so much chaos while you're trying to focus on your procedure. Hello everyone, I am Dr. Bhavna Agarwal, aesthetic dermatologist, facial aesthetic consultant and a beauty psychologist. And in today's video, I'm going to be sharing some client-centric apprehensions and concerns that need to be addressed before going in for any injectable procedure, especially if it is being done on someone for the very first time. The time spent in the initial consultation, assessment and analysis is what will help you gain their confidence and vice versa. And once that is done, you already have accomplished half the job, because it is the overall procedure experience and the results they achieve that will keep them coming back to you for more and more. So this video is for millennial aesthetic practitioners who are pursuing various non-invasive aesthetic injectable procedures like Botox and fillers. And through my videos, I want to share with you the various practice points and emphasize on the patient handling techniques in clinical aesthetic practice so that you can execute your procedures smoothly. These videos will help you deal with the day-to-day setbacks that you face in your clinical practice, bring finish to your procedures, and execute and deliver the results with confidence. So every once in a while we do any procedure of Botox or fillers, we witness situations like having gone through a complete round of assessment, analysis, having done the Q&A, and after putting the topical anesthetic cream, just while you begin to inject, the patient denies taking the treatment, or they say that they would take it on another day. So where is this fear of imaginary pain coming from that feels so real? As aesthetic clinicians, the onus to identify the pain threshold of the patient is of primary importance, as you would be injecting someone on the face in their full consciousness, and at the same time, it is very challenging because this is not something you can ask right away. Once you identify, only then can you take measures to alleviate it. Facial aesthetics is a new normal form of healthcare. It is a mind that is being healed while you treat the face. So identifying the basic apprehension is important for positive outcomes. Trypanophobia is a fear of needles. Almost 1 in 10 people have it, and it comes or develops out of certain childhood experiences. So these are the individuals you find denying the treatment just before you have started to inject. You can help such patients by creating calm and friendly environment or surrounding, maybe by playing some soft music or their favorite music. Talkesthesia is another technique that can be used. A friendly talk about pleasant experiences goes a long way in calming someone. Have someone to hold their hand, and this really works. Make sure they are well rested, especially and they are not empty stomach. Some breathing exercises can also be helpful. There are some tools like these stress balls or some facial vibrating devices. These can also be used. Then there's another category of patients who will make loads of noises and do all the screaming and shouting while you inject. So these are the ones who were told to scream on a giant wheel. That is their way that they have developed to confront fearful situations, and these ones will need a lot of talking, and the noise they make is just to alert you to be extra careful around them. There's a lot more to aesthetics than what the eyes can see. It is not hospital medicine, it is not prescription medicine. It's a whole new world of healthcare. You need to be spending lots of time with your patients, understanding them, their concerns, their apprehensions, their requirements, and then give them ways to deal with them at the same time. If you understand them, you have them for life. Thank you for watching. Stay tuned as I'll be sharing some more informative videos every week.